in my favorite areas to visit. All right, well, today our parent webinar is talking about mental health and neurodiversity, clarifying choices to complex struggles. I know as the past 2 years have been interesting, needless to say, for many of us. I know you know, I guess recognition or what everyone's been going through and the discussion of mental health has been at the forefront of many conversations. So I'm excited to have our special guest here from Wonder to talk about this topic and to discuss, what that looks like and what some of those struggles are. I'm Tiffany Feingold. I am the co-founder of Guiding Bright Minds, and so excited to have you guys be a part of this discussion and conversation. As we're done with the presentation and maybe even during it, I know that our speakers, Bridget and Mary Beth, will pause to allow for question and answers. So if you see on the bottom of your screen, there's a section called Q&A. As we're going through this, please feel free to put in any questions that you have so we can address that as we're done with the conversation. So let me tell you a little bit about myself and my journey. So I am a parent of a neurodiverse child, and I was working in a different area completely in corporate America. And through the experience of when we had our son and what he experienced early on in preschool of getting kicked out of schools and swim lessons and anything that was really unstructured, loud, kind of chaotic situations, he had a hard time adapting to that. And so as a new parent, not sure what that was, what that looked like, what did that mean? It was quite a journey. It was exhausting, overwhelming. Your heart broke because you just wanted to do everything you can to help your child, hoping that they're happy and that they're connecting with others and making those friends. So it was through that experience and my husband's experience, because he grew up with undiagnosed ADHD and dyslexia, and he struggles significantly through school and just being an out of the box learner and not having anyone understand the accommodations that he needed, and what that looked like through that process. And that's why my husband and I founded Guiding Bright Minds. We wanted to help parents on their journey. We wanted to be there to let parents know and caregivers that you're not alone. And what can we do to work together to help you meet professionals such as Wonder, who provide services, who help parents also understand what their options are, understand the services that are available, understanding all those questions. What's the difference between a medical evaluation versus an educational evaluation? Where do I go when I want to get an assessment? How do I know it's an accurate assessment? What's an IEP, a 504? There's so many things to research. And so the purpose and mission behind Guiding Bright Minds is to enable our parents, to look and to find those resources and tools to connect you with the professionals that are dedicated to serving our children, to uniting you with other parents who have those same experiences. That has been life-changing for me, is to meet other parents and collaborate with them on their experiences, and then also again educate. And that's why we provide these 2 free webinars every month to help parents through that. So if you haven't joined as a member, it's free for parents. We'd love to have you a part of the community. We've been doing this for about 1.5 years, so there's still so much more that we want to provide, and we'd love to hear from you. On our website, you can connect with us. You can ask questions about your journey. How do I find psychologists? What does this look like? Or even provide suggestions. I'm interested in this topic. So this is a ship that we're all driving, and I'd love to hear and get that feedback and information. So thank you so much again for joining us, being a supporter, and allowing us to help you on that journey. Let me introduce our speakers today. First, I want to introduce Mary Beth Johnson. She's a licensed professional counselor candidate. She received her degree from the University of Colorado, Denver, after multiple years of employment as a wilderness therapy guide in Southwest Colorado. Moreover, she has worked in inpatient and eating disorder recovery settings. She has an extensive experience working with adolescents and young adults in both therapeutic and educational environments. Additionally, she has skills in supporting parents and families whose child loved or loved one has needed wilderness intervention. Mary Beth has a relational and experiential approach to therapy. Mindfulness and body awareness are central to her practice. As someone who has raised a large family, Mary Beth finds vitality in navigating complex family dynamics and creating spaces for family members to experience loving and honest communication. In her free time, Mary Beth loves to rock climb, backpack, ride her bike, and spend time with her family and friends. Thank you so much, Mary Beth, for being here. We're excited to have you a part of this conversation. Next, I would like to introduce Bridget. She received her BS in psychology from Colorado State University. Since then, she has spent 15 plus years of experience in marketing, strategy, planning, branding, and sales, working specifically with entrepreneurs and small businesses. This expertise developed out of her own experience of owning and running a social dance studio and spending 15 years working with couples, groups, and individuals wanting to learn to dance. That's very exciting. I love that work. Working one-on-one with individuals and seeing the impact of growth and connection to community guided Bridget back to the world of mental health. She has since worked with mental health agencies and therapists supporting their marketing and admissions teams. She loves working with organizations that are supporting and the growth, evolution, and healing of individuals and families. She completed her master's in counseling at Regis University and supports adults and couples in therapy. In her free time, she gets to the mountains for hiking and camping with her dog, Chico. She still dances and enjoys cooking, traveling, and spending time with her family and friends. So thank you so much, Bridget. And I will turn it over to you to kick off the presentation.
Thank you, Tiffany. There's Chico. He sneaks up back there, so hopefully he's not too distracting. He's one of our co-presenters today. Thank you so much for everyone for showing up and attending. I hope what we provide today will feel informative and useful, and everyone's on a different stage of the journey when it comes to mental health. And the goal of this presentation is really to create sort of a really nice framework, or maybe sort of a really kind of overview of what's out there and maybe how to navigate it. I didn't realize we would have people from outside the US, so I'll just sort of put that disclaimer in there. This is really kind of US based services. I'm not sure what's available outside of the US. So let me shift over and share my slides. Okay. Is that good? Can we see it? Okay. All right. So real quick, I'll just give you an overview on Wonder, our organization, and why we have sort of a unique expertise in this area of sort of navigating the continuum of care. We are a therapeutic and coaching organization based here out of Denver, but we actually have clinical teams in a handful of cities around the US and support preteens, teens, young adults, ages 11 to late 20s, their parents, and their family system as a whole. We provide support outside of a traditional talk therapy office setting. So our therapists are mobile. We go meet with kids in their home. We use activity-based support. We use it that way. We are doing therapy, but we're using activity because it helps kids kind of engage the process a little bit more and a little bit more authentically. Often it is helpful too when kids are feeling maybe more shut down to traditional therapy. So we find engagement with kids in that way. We work with parents too. Usually our families are set up with the 2 therapists. And what we're doing that for is because we're really focused on this relationship between parents and kids, that as struggles intensify, that relationship can become really strained over, especially when it's over a handful of years. That can impact other siblings in the family system. And so we're really kind of paying attention to struggles with kids, but also for parents and your experience as you navigate all of this on the mental health side, and really how is that impacting the relationship. We work with lots of different struggles, but some common ones are under the neurodiversity category: ADHD, autism, executive functioning. Technology shows up a lot for our families as far as a struggle. They're kind of trying to navigate social anxiety, school refusal, family conflict, risk taking, substance exploration, are just a handful of some of the struggles that are showing up with our families. For our presentation today, as someone who works both in the admissions and outreach side and as a therapist, what I know to be true is we hear as parents call us and we talk and we hear their stories. There's a lot of common questions and common history that we hear throughout the journey kids and parents have had from kind of elementary all the way through high school and beyond. And so that's really what the goal of this presentation was to say, hey, we're hearing this a lot from a lot of different people. Let's start talking about what's out there. How do we start navigating, and when is it the right step? When do I need to step up and add more different types of support for my child? When do I as a parent need to add in support for me? What about the siblings? So these are some of the questions we're going to aim to sort of answer. And our expertise lies in this because we are our program really helps families at a unique place in the continuum of care. So, and we'll talk about that continuum in just a moment here. But we really help families sort of right before a higher level of care, like an out-of-home placement, and right after. So we're really kind of at these decision points where parents have tried a lot of things and it may have worked a little bit, but then maybe struggles continued or maybe escalated in a different way. So we're really kind of working with families kind of along that continuum to kind of help support them therapeutically, but then also we're not always the right fit too. So we have to know kind of where to kind of guide parents in those next steps. So those are some of the questions we'll attempt to answer today. Some takeaways from today, just a general knowledge of the continuum of care of mental health services. And so I think just the kind of, as a therapist that does outreach, and my job is to know about services out there, it's still really hard to find services, right? It's, it's hard to know who's the right person to pick. What's the kind of support do I need? How do I even find it? Will they call me back? There's a lot of systemic struggles that we can face in mental health. So one of the goals here is to just sort of provide a framework, sort of a general overview of what is most common as far as the services out there. We're going to talk a little bit about the struggles that might necessitate a change in levels of care. We're going to do a highlight on the Wilderness Therapy Program. Mary Beth will really speak to what those programs are like, why they make sense, when they don't make sense, and what are some of the goals for that for clients in those programs, and then how to access these supports. All right, so here's, again, I'm kind of wanting to put sort of this disclaimer. This is a general overview. There are definitely, given the cities that all of you are from, there may be variations of this. But this will kind of, again, give a general framework of what parents can expect. Starting, hopefully you can see down on the beginning steps support, as kids start elementary school. Maybe they're like Tiffany shared about her child, in sports, and getting some feedback that there's some maybe behavior stuff showing up. Kids are starting to struggle in some ways, whether that's in school or socially. We'll dig into that part more, but some of the first steps parents start exploring as they need support is in the realm of kind of individual therapy. I put in a couple examples: ABA therapy, which is really kind of addressing those behavioral pieces, occupational, maybe a different type of coach, IEPs, the sports that are available in school. So those are kind of those first steps to get the support in those earlier years. If we step up from there, anyone needing a little bit more support, some of the things might be added on as kind of a next layer would be maybe doing family therapy, maybe couples therapy is something as parents are finding strain in the relationship. Maybe that's a piece of it. Parent coaching, maybe parents often will reach out for some maybe medication or different types of testing. As time goes on, if some of these additional supports are working in some ways, maybe some struggles continue and maybe start to escalate. And when in these next two pieces, the emergency short-term inpatient or out-of-home placement, and we're going to talk about kind of the when and the struggles in a bit, but the next in short-term inpatient might be a behavioral health hospital. This might be if someone needs to be on a mental health hold, or if there's a suicide attempt, there might be a 5 to 7 day stay. There's more and more day programs for mental health showing up for adolescents. And again, this is going to be different in every city. There might be pieces here where there's some legal interactions. If there's some behaviors that are, a little bit more risk taking or risk exploration for kids. So these are some of the places that in settings that parents might find themselves. The out-of-home placements are the longer term. This is when parents choose to say, when they've been on a long journey, and we're going to discuss this a bit, this is a big step. This is a really big step, both financially, but also emotionally. It's really tough to say, hey, I feel like I'm at my wit's end and I've tried everything. I don't know what else to do. My child needs more support. And so that's what these out-of-home placements are for. And that's where wilderness therapy lies, but also residential treatment, boarding schools, and the like. On the other side, when kids come out of these settings, they're coming back home often. And so coming back home to kind of back into school, back into the family and home setting, where they have access to technology and substances and all this, and then also trying to navigate mental health pieces. Without enough support here on this transition and aftercare side, things can regress and struggles can reemerge. Ideally, there is enough support here, and then as kids and parents and family systems heal, getting a lot more traction, really developing these skill sets, then obviously a weaning off of services and going back to kind of traditional outpatient once a week, once a month type maintenance work is definitely where we want to head. So generally speaking, this is the continuum. Let's talk a little bit about what this looks like from the story. You heard me say, as we talk to parents, as they call, we hear a common theme as far as kind of what happened over the years for their child, for their family, and where they're at now. And so I'm going to sort of reference this a little bit. Obviously, this is very generalized. I know everyone's experience is very unique and very individualized. And so there may be some of these pieces that feel relatable. There may be some that feel less relatable. If it's something that feels relatable, put it in the chat, put a thumbs up or whatever, if you feel like you want to engage and say, yeah, I've had that experience. I think there's support in having this connection with each other and knowing that there's a lot of us out there struggling. I'm organizing this sort of in elementary years, middle school, and high school. And I'm doing that because as kids go into those school years, that's often where we might start seeing some behaviors, maybe before, but oftentimes as they start elementary, it could be some disruptive behavior in school. Maybe there's some different social struggles, maybe some anxiety is showing up. For a lot of our kids in our younger elementary years, emotional dysregulation, maybe some outbursts and big behaviors, big, physical reactions are happening maybe outside of school. That might be at home or socially. Level of care, this is kind of those first steps that we go into, often where speech occupational therapy could be ABA. I put floor time in there. That's a little bit of a kind of adjacent to ABA. School counselors, IEPs, therapists might be all part of this, and exploring how are the different ways we can help my child sort of start kind of finding some traction and finding some kind of uh, success as far as the steps in school, and starting to feel like, okay, I'm getting this. And for parents too, this is definitely part of it. It's hard. It's kind of like it's hard to see our kids struggle. So that will bring up different things for parents emotionally too. And so that's all sort of emerging and kind of starting in these earlier years. As we start moving into middle school years, some of the things that really shift that we hear a lot from parents is this piece, puberty, biology, right? That starts showing up, and kids by nature in these years are moving into high school years are in a developmental state of wanting to start creating more separation, more individuation as their own person. Like, who am I? What am I all about? And they start developing that and understanding connection socially, kind of pulling a little bit away maybe from parents a little bit and saying, this is who I am. So we're going to have different pieces coming into the picture. You'll see on here social influences. That can also be different sorts of technology, social media, identity exploration. That covers everything, right? Anything from gender, sexuality, cultural, and even identity with their neurodiversity. How is that a piece of the picture for me? What does that mean about me? Are some of the questions that begin to start showing up in these middle school years. This is where kind of the mental health piece starts showing up more and more. So we'll start seeing maybe a little bit more anxiety, maybe more social anxiety, maybe more depressive symptoms, maybe a little bit more family conflict. So kids might be kind of pushing back a little bit more. But we also sort of see the either kind of pushing and kind of conflict seeking, or maybe a little bit more isolation, kind of withdrawing, going inward a little bit more. Basically, on some level for kids as they go into middle school, kind of having a sense of, I want to be normal, right? There's sort of this sense of, I don't want to stand out. There might be bullying a part of pictures. So all these are pieces that are kind of creating and kind of setting in root pieces that are outside of just behavior. This starts kind of impacting self-worth, impacting how do I see myself? Do I feel like I can succeed in school? I feel like I'm trying really hard. It feels like I keep getting stuck. So some of this is what's showing up for kids, and for parents watching and kind of navigating that with them. How do I help my child feel competent, feel good about themselves? These are all the pieces that are a part of it. As struggles here intensify, if parents are seeing self-harm, if there is mention or kind of talking suicidal ideation, or even just kind of more and more withdrawn behavior, or technology is a consistent ongoing struggle, I would say pretty much for almost all of our families. So these can kind of lead into where creates distress in the relationship between parents and kids. At this stage in the game, often parents are adding in additional levels of support. So this could be bringing in a family therapist. This could look like doing more in-depth testing and assessments. This could be adding in kind of more like a little bit more, I would say, outside the box. Like I put in neurofeedback here as an example. Things that might be outside maybe traditional therapy. And again, depending on the city you're in, there's more and more of these types of services out there and being offered. Coaches are often really a great resource here, ADHD coaches. Maybe there's tutors a part of the picture. I think at this level of care, really developing a good connection between all the people that are supporting the family, for kids and for parents. So if there's a parent coach in the mix, if there's a psychiatrist in the mix, if there's a tutor, a therapist, having those people communicate with each other too on behalf of the family system is really a helpful step here. I put in Team Wonder just because this is where we fit into. We have a therapeutic team that works with the family as a whole, and we collaborate with providers outside just to, again, it really is sort of wrapping our arms around the family system. How do we help this relationship for this child and for the parents and for the family as a whole keep moving forward and decreasing the intensity of any symptoms that are showing up. As we go into high school years, there's been more years of struggle if things are intensifying in the cases where things aren't getting balanced or getting just more at a balance, right? Like if kids are continuing to struggle into high school, this more rooted identity and I'm a broken kid or there's something wrong with me takes a little bit more firm hold because there's been more years of experience kind of, connecting to that or finding identity in that. Family conflict, just longer term relational strain. I think what we see for a lot of our families that are really struggling in high school years is parents are exhausted, parents are scared, parents are desperately trying to find the different thing that will work to help their child. I put in the phrase here, we're at our wits' end. That's a common thing we hear, a very sentence. Like I feel like I've tried everything. I've told the story a million times. I just don't know what else to do. So that's sort of parents get to this place and kids and parents are kind of, in a sense, there's been so much distress in their relational bond that it can feel very much like they're kind of in opposite corners and kind of getting to that place where it feels like, yes, we love each other, but we don't want to try right now. Like, and it gets very stuck. For kids, there's often significant anxiety, depression. Again, not always. I don't want to say this is everyone. These are generalizations, but lots of anxiety with pretty much a good majority of our kids. You heard me mention isolation, withdrawal, self-harm, suicidal ideation. At this stage in the game, you might, if suicide is a part of the picture, there might be 1, 2, maybe several stays in a hospital if there is attempts or ideation or threat happening. Same with self-harm. So substances are more and more a part of the picture in high school years. Again, kids are trying to connect often. This can sometimes result in addiction, but often it's self-medication, a way to connect, a way to create relationship with peers. Romantic relationships show up more so in high school. So kids are exploring what that means to have an intimate partner. You see legal system here too. Maybe, there's a lot of different ways that can show up. So these are some of the struggles that might be showing up as things continue to intensify for kids and families. You hear me say kids and families because it really is for the child. Parents are reaching out for support for the child, which, yes, that is definitely needed. And we know as much our parents need that support. Our parents need guidance or connection. That sense of I'm not alone in this is really, really helpful to know, but to also feel. And also to process the emotions that are happening for parents, the years of fatigue and trying again and trying again, and fear and what's going to happen for my kid as an adult. What is the future going to bring? This is totally not the route I thought we were going to be on. And so these are a lot of sort of the stories of what's showing up for our families. So level of care supports here. When a family system stays together, that's always the goal. And I think it's always the hope that we can prevent higher levels of care. As kids are living in their home, some more kind of robust supports for the family system are programs like Wonder, where we have multiple therapists who are working within the home environment, behavioral health hospitals. There are more and more mental health day programs, which I think are really great, where they can sometimes combine a component of schooling, but then also a very strong supportive mental health piece of it. And then substance programs often will have different PHPs, which is a partial hospitalization program, IOP, which is an intensive outpatient program. Those programs, those two, I don't know why I don't have them on here, but they should be on there. Hospitals will often offer those. Those are a lot for both substance and mental health. Hospitals are often group therapy of different types, and then usually some individual support in that. So those are some different levels of care when kids are still living at home. If parents decide that, and maybe necessitates, I think when things are when it gets to the point where for kids that it's not safe to stay at home, like if there is repeated suicidal attempts, if there is substances or eating disorder or different things that are going on, it might be the best fit to go to an inpatient level of care. And so this means that kids would go to either residential treatment of some sort, wilderness, therapeutic boarding schools. These are all different options where kids will live full-time at this place, this inpatient location, doing a lot of work, having a lot of support, having sort of stepping out of the struggles of home. They don't have as much access to technology, no substances, kind of outside school and family settings. So they can really kind of have this time and space and support to work on the mental health pieces that are impacting things. From here, let's take a moment. We can pop any questions into the Q&A. I think there's a couple, but I haven't been able to really see them. So I apologize if I haven't addressed them. But feel free to throw some questions in there if anything showed up. I'm going to hand over the mic to Mary Beth, who has her background as a field guide, therapist, and trainer in the world of wilderness therapy, but then also is now working as one of our therapists at Wonder, helping kids both before and after that type of program. So this is really to kind of just pull out and highlight what the heck is wilderness therapy, why does this type of program exist, what's the point, and give a little bit more deep dive into just this aspect of it. So Mary Beth, I'll turn it over to you.
Yeah, thanks, Bridget. Yeah, to give a little bit of insight. So I was a wilderness therapy guide. I also trained guides before becoming a therapist that primarily helps parents in a supportive role as their child is going through wilderness therapy. As a guide, I had a week on, week off schedule. So I've spent over 600 days in the field, so 24/7 with clients in the field. So I have some context of what really goes on out there. So wilderness therapy is a 8 to 12 week intervention in a remote wilderness setting. I say intervention because this is really when families are in high stress, high conflict, at their wits' end, and the child or the young adult is really engaging in some unsafe behavior that really needs tending to. This is usually for adolescents and young adults. However, wilderness therapy is expanding. The program that I worked for, Open Sky, is now engaging in a younger adolescent or early adolescent program as well. Wilderness therapy uses a team of interdisciplinary professionals. At Open Sky, there was a psychiatrist, there was an extensive medical team that did medical checks in the field. There was also a very large field and operations team putting drops, making sure that all the groups were getting the things that they need, all individuals got everything that they need, as well as clinicians that work with both individuals and the families back at home. So it's really a big team that is at service for your family and your child or individual. This addresses individual and family concerns. So wilderness therapy has origins in behavior modification and mainly individual therapy, but has really evolved and progressed into more of a systems approach in many of the programs that I was a part of and have seen. So there's a big relational approach, not just like dealing with familial system concerns, but also how that individual interacts within a community. So each individual is put into a group where this group is completing tasks, going on adventures, and that is a big focus within wilderness therapy. Another focus is task completion. So they're in this community and they're completing tasks. They're getting one from one place to another. Other programs really hone in on like agroforest or agro therapy. So they're like planting crops. My program, it was mainly based in adventure and backpacking. So packing backpacks, making meals, like making a bow drill kit and making fire. All of these tasks throughout the day help students, clients feel more successful. A lot of the individuals that go out to wilderness therapy really are struggling with motivation and maybe even getting out of their room or home. And so wilderness therapy is kind of a metaphor for the success that they could feel outside of a wilderness setting. There's intentional separation that happens. That's kind of the basis of wilderness therapy. So intentional separation from families. A lot of families are dealing with high conflict and maybe some communication that isn't always helpful or supportive. And so really separating the individual from their family so that a clinical team can really support communication through letter writing specifically, and some parent phone calls. Sorry, there's some stuff popping up in the chat. Also, intentional separation from technology. This is a big piece. So a lot of young folks deal with technology addiction and also maybe bullying on social media or social media attachment. And so taking a step back from those things can really help the individual identify what they're really seeking, what they're really searching for. Other factors such as bullying at school or drug use, separation from that, all of that intentional separation is to really get an accurate assessment of what is going on. Does the individual need connection? Does the individual need more communication skills? Does the individual need some medication management? These are big things that we're assessing for in wilderness therapy. Also in wilderness therapy, they're getting adequate sleep. My clients got like 8 to 10 hours of sleep every night. They're eating 3 meals a day. They're on constant supervision from the field staff, and they're getting adequate exercise. So getting them into healthy habits really helps gets a broader picture of what else they might be struggling with. And then we can switch slides, Bridget. Okay. So after that broad stroke of what wilderness therapy is, please feel free to pop any questions into the Q&A or the chat. I'm happy to answer them. I do want to address who wilderness therapy does benefit. So wilderness therapy benefits individuals and families that need drastic change in patterns. Again, there's high conflict. There might be some risky behaviors going on at home, such as multiple suicide attempts, self-harm, substance use, inability to leave the home, really attached to technology. So it really benefits folks that are really needing drastic change in these patterns. Individuals who have different learning styles. The ratio for wilderness therapy in terms of guide to student is usually 3 to 1. So there's a lot of support out there. Sometimes it's 2 to 1 sometimes. So individuals are getting a lot of support in learning new tasks. And also it's a really hands-on approach. It's learning by doing, and you're out in an environment that's not enclosed like a school. And so a lot of folks who are neurodiverse really find vitality through a lot of the activities that are a part of wilderness therapy. Individuals who need further mental health assessment. Psychological testing happens out there, medical management. So like, is the med working? And can I get my child to sleep enough so I know if the medication is working? So it's like really stabilizing some of those external factors that are hard to at home, so that we can see what is actually working in terms of like approaches, medications, or ways of communicating with that young person. Also, there's constant behavior monitoring. Yeah, and also wilderness therapy is a great intervention for families who really need different communication skills, where communication is really, the people in the family system are really missing each other. This is an intervention that really creates a lot of intention around developing not only communication tools, but emotional regulation tools. Open Sky had a huge aspect of the program was based in like mindfulness and emotional regulation, and bringing like mindful communication to relationships. Parents are often encouraged to go through a parallel process. So they're also learning these communication tools and emotional regulation tools to kind of meet the young people where they're at. Okay, we can go on.
Oh, sorry.
No problem. So with that, thanks, Bridget, for being my clicker.
I forget that I've got the control over here. Okay, go ahead.
So with that, who does wilderness not benefit? So individuals who are displaying uncontrollable violence. This can come in physical, sexual, of a physical or sexual nature. Those individuals aren't appropriate for wilderness. However, there has been, I do want to contextualize this, there has been points in high conflict in families where a young person has maybe struck or attempted to use physical violence. However, this is not common within their behavior. It's really reflective of how the system has struggled, and that child might have one instance of like acting out in a violent manner, but that's not a consistent part of how they behave, if that makes sense. Individuals who display low functioning that would be unsafe for the wilderness setting. I have 2 examples of this. I had a client, their parents were very, in both of these cases, parents were really at a loss of what to do. And so they sent these 2 individuals out to the field. One of them had an extreme developmental delay. It was hard for them to go to the bathroom without assistance from a guide. It was hard for them to do just basic hygiene tasks without a lot of instruction from a guide, such as brushing their teeth. These individuals might not be suitable for a wilderness therapy intervention. Another example is there was an individual I worked with a dual diagnosis of ASD and OCD. And the OCD, the rituals associated with OCD was really preventing that individual from engaging in the community and also engaging in daily tasks. And so wilderness therapy was also not appropriate for that individual in particular. Individuals who have severe disordered eating. So there have been some folks who have struggled with disordered eating, but if there's if their disordered eating prevents them from really keeping on weight, ability to function in like a physically demanding environment that the outdoors kind of demands, that is not appropriate for wilderness is not appropriate for those sorts of individuals. And also individuals who have medical issues that also prevent them from effectively living outdoors. However, there's a lot of exceptions. Just to give you an example of an exception is diabetes. I've worked with multiple students who have had diabetes, and they have a certain level of independence with managing their blood sugar. So that's really what these programs are really assessing for, is like, are these medical issues severe enough where they wouldn't be able to really function and live outdoors without some medical treatment? But if they are kind of functioning independently and can be accommodated with our medical team, then there's of course going to be some consideration in that realm. I hope that gives some insight into what these programs can be about. And again, pop your questions in the Q&A or the chat, and I'm happy to type out some answers. Thanks, Bridget.
Thanks, Mary Beth. How and where to access support. I put Guiding Bright Minds first because I think that's exactly what Tiffany's goal was as far as getting this set up is. And, you know, while we are focused more on the mental health side, we know there's a ton of other types of support parents and families need. And so I will sing the praises of Guiding Bright Minds to all across the land, because I think Tiffany's been doing a great job. And, you know, there are other resources online that might be similar to that too. I think Guiding Bright Minds, you know, the niche with neurodiversity and sort of the diversity of the supports on there are a really good starting point. Consultants, I kind of use this generally. There's different types of local consultants, resource gatherer people out there. And I think this is a growing field. There's a handful locally here in Colorado. I know there are some different types out there in other cities. So these could maybe they might call themselves special needs advocates or a special needs consultant, or maybe I put in here educational consultants or therapeutic consultants. So I kind of am generally broadening that term and just saying consultants in general, or like I've heard of athlete advocates or academic advocates. So kind of folks that are sort of the information gatherers. I think those are some different terms. In the realm of looking for higher levels of care, there are educational consultants here that can both provide guidance towards education facilities, schools of different types, but then also places like residential or wilderness programs. I put Wonder in here because part of our process is finding programs that are sort of the in-between. Wonder's just one example. There are others, but it might be worth having an intake call with their admissions person. Those admissions people are often connected to the outreach, and they are hearing the people in the in-between of going into or out of higher levels of care are hearing kind of what's going on. They can get an initial sort of assessment and intake, and at least for Wonder, I can speak if we are talking to parents and we definitely are like, okay, this is not a fit for us because maybe we can't, there's too many safety concerns here, we would recommend this, and then we can connect them to people. So we're really more about like, how do we find the right spot for this family? And that might be us and it might not. And that could be for a lot of reasons, both what's going on and also financially. So I might shift into that. I know there are a couple questions around this. With Wonder, we don't work with Medicaid. Unfortunately, Medicaid and insurance don't cover a lot of these types of programs. It is an ongoing struggle. There are more and more programs I know with Wonder, and there's the Sky's the Limit Fund. There's different scholarships and funds and programs that are creating more and more opportunity to fund fund kind of higher cost programs, but there are residential programs and different things like that within Medicaid systems, and insurance does cover a lot of substance programs and even eating disorder and things like that. So depending on what's going on, you'll have a variety of pieces of it. So the other question was about funding covering room and board for families needing long-term residential care. Yeah, I think that's kind of under the same category. It's hard. I wish I had great answers for this piece of the puzzle. You know, it is, I think it's getting better. I think there are more options, and there are absolutely limitations in the realm of financial support. I know that's a bummer question or a bummer answer to end on. So if there are other questions, I'm happy to answer them. Tiffany, I'm conscious of time too. So
yeah, just to hop in really quick, Bridget, there is
Yeah.
a code, an insurance code that has been developed for wilderness therapy and other forms of residential treatment. Just want to give insight up to that. There is a code, however, that code is not widely accepted yet by many insurance companies because it is a newer form of treatment, relatively speaking.
And one of the questions, you know, that was brought up too is just, you know, there's so many different programs. So it was a question about the wilderness therapies and programs that were out there. And that's where, you know, when Bridget mentioned about, you know, there's so many different specific consultants there, because there are so many choices that they dive into the details as far as what your child's needing, what they're experiencing, what they're going through. And they visit all of these wilderness programs, know firsthand which one's going to be successful for different children, different age group, different experiences, because you know, there are so many choices, and especially with that level of investment, you know, having a consultant work with you that dives deep into those. So if you do want to look at those consultants or have any advice on that, I can make some recommendations on those. With Guiding Bright Minds, because there's so many different therapies, you know, we haven't dove into the wilderness. We're not consultants from that perspective of diving in there, but we can connect you with those tools and resource that helps dive into those areas. So just wanted to add to that as well. It looks like, oh, go ahead.
Well, I was just going to piggyback and just say, I think it is definitely worth the exploration too, because there are definitely programs that are much more suited to neurodiversity versus some others that might be geared towards a little bit different other struggles that might be showing up. So I think it's definitely worth the research to find the right placement.
Yes, because that is crucial. And it's just like any, whether it's a psychologist, whether it's a tutor, whatever types of services you're looking for, I always recommend interview at least 3 people. Be very specific on, you know, kind of what you're looking for. Maybe you're like me too in the beginning. I'm like, I didn't know what I was looking for. I didn't know what to ask, you know, what that journey would look like. But interview at least 3 people to find out what are your you know, approach to working with families, the level of communication, how are you going to support my child, what does that look like, just so you can get a feel for you what might be the best fit and what that looks like. So yeah, and another question came in that says, is there any indication that interventions produce better results, or is this just the path that my child's on? Great question.
I was just going to speak to that. I think that consulting with other folks about what's going on for your child, it's just nice to have a sounding board. Again, like being a parent can be like a lonely experience when your child is going through struggles, and just like widening that sounding board can be really helpful to understand what interventions are appropriate and what interventions you can reach out to. I think that's really important. I know that that's kind of a wide stroke answer, but hopefully that's helpful.
And I'll just add a little bit on to it. I think too, every child's journey, and again, I'll broaden it to family. Every family's journey is so unique. So it's hard to have these discussions because we're using these very big generalizations. I think the path that your child is on is often, I think one piece is in those beginning years, a lot of it is about how do the behaviors get adjusted to fit the system a little bit better, whether that's the school or family. So kids are kind of able to keep progressing in school and having successes. And as they get older into middle and high school, that path shifts a bit more to look at the relational piece. Kids by nature, we all as humans by nature want connection with others. And as kids are growing and struggling with connection, that's where some of those mental health pieces can start to take root, because it starts to feel like I'm not okay. I don't just have ADHD or ASD. There's something wrong with me. Like those kind of internalized messages are the pieces that we really want to pay attention to. So the early interventions are a piece of the puzzle, and as kids develop their identity, their self-worth, those messages around what's wrong with me, like, and feeling to addressing that is a really, really important piece. I think earlier as they go into like in those, middle school, high school, because kids are in their school system assessing for, again, how normal am I? How do I fit in? That is a very appropriate developmental stage. But if they feel outside or that they're failing, a lot, then that can be a really big piece of it. So I don't know if that totally answers it, but I think it kind of shifts from behavioral and early intervention into relational as they get older.
Yeah, and when we're going through this, I even look up some of the statistics. It's said 50% of adolescents with ADHD, are diagnosed with depression or anxiety. 40% of autistic adults, 8% of those autistic youth, 20% of children with dyslexia. So, the one question about early intervention, when you think about just the compounding factors each year as they get older, and there's more realization, because I look at my son who's still young, and there's that innocent of kids will just play to play, but it's getting to the age where they're choosing not to, where before it was like, sure, I'll play, but now it's selection of the friends and who wants to be around him. And that's where I think about that early time frame in which that help or that therapy or whatever is supporting his emotions now to prepare for that adolescence, and looking at these statistics of just those that are diagnosed versus those that are not, just helps through that process. And especially parent coaching. I mean, one of the things I've learned, as I mentioned when we started, my connection and uniting with other parents of neurodiverse children has changed my life, because they get it, they know. And that's where I want to create that community where we're all supporting each other, where we're working together, we're providing that grace to say, everything doesn't have to be perfect. And let me just give you one quick example. It was our son sitting down at the dinner room table. Well, dinner is awful. And it's like, who are we trying to accommodate? Why does he have to sit there through dinner? So we'll play charades, or we'll even play Uno, or we'll let him run around, to get the energy out and come back and sit down. But also take a look at what expectations that we're putting on our children. And for what? I don't care if my kid sits at the table. I care that he eats, but that's why we have, okay, let's do charades and come back and have 3 bites. But he's not feeling, again, constantly bombarded, like sit down for the hour that it takes him to eat, maybe 2 hours it takes him to eat, but just allow that flexibility. So just wanted to add that in there. And again, Bridget and Mary Beth, thank you guys so much for your time, for doing this, for sharing, and all of you on who joined. I don't know if there's any other questions. Is there any? It says thank you for today's presentation. So thank you. And I know we've had some chats of thank yous as well. So appreciate it. Reach out to me. I'm here to help on the journey. If you want to look for wilderness programs, I can put you in touch with some great people who know them. So give me a call, reach out to me, shoot me a message. So Bridget, Mary Beth, anything else you want to add real quick before we leave? All right.
No,
wonderful.
Just a thank you.
Yeah, thank you.
All right. Bye, everyone.
Bye.